Whole body health starts in the mouth. Did you know if your gums aren't healthy, it can lead to serious health conditions? This next segment has been sponsored by Troy Family Dental in Illinois. And you can see how Dr. Boatman's office treats gum disease with the latest technology so you can keep your mouth, your teeth, and your body healthy.
70% of the entire population has one form of periodontal disease, starting with what we call gingivitis, which is the very initial infection that can progress to bone damage and tooth loss. There are really no symptoms at all. So a lot of times patients come into our practice and they haven't been to the dentist in 15, 20 years and they're wondering why their teeth are loose and they're getting spaces between their teeth.
When that starts to happen, that means the bacteria is breaking down not only the gums, but it's causing bone to recede because it's traveling below. I kind of explain it to my patients, the best way of explaining it when you get a gum infection, it's like a splinter. Your body's response, your immune system will swell, the gum tissue is going to swell, and what it's trying to do is basically push that tooth out. So when people get severe periodontal disease, they will actually end up losing their teeth because it gets to that point.
We don't want that. So head to Troy Family Dental today to check for periodontal disease. And if it's hanging around inside of your mouth, they'll treat it too.
We have a cutting edge way to treat periodontal disease now, where we've always known that it's about the bacteria. Now we have some cultures that we can do that we can send in to find out exactly which bacteria we're dealing with. It'll tell us the exact antibiotics to use, and with the therapy that we use here, and we give the patient some things to use at home, we can get rid of that infection and we can help make sure it never comes back.
Good dental hygiene, it does affect your overall health. A lot of patients don't realize the bacteria with the gum infections, actually that bacteria can travel and go through your bloodstream, and that actually can lead to like heart disease, high blood pressure. Actually with women, it can preterm labor, low birth weight for the babies. Actually, it can affect your diabetes with your blood sugar levels.
There are so many people that just avoid regular dental care and just regular dental checkups, and it is just so important that if patients can get that initial care every 6 months, we can find things very early so that there's less cost and less things that we have to do.
Early detection makes room for less infection.
We're different with our periodontal treatment here than I feel like regular offices, because not only do we treat with the buildup and bacteria below the gums, we treat the bacteria. A lot of patients will get the scaling and root planing and the traditional deep cleaning, but we treat the bacteria along with that.
The cutting edge part of it is we actually use microscopes in this. So we can take a small sample of the patient's plaque, put that underneath the microscope and see what is underneath that microscope. If we find some high risk bacteria, then we can send the culture in. There are 11 periodontal pathogens, 11 really bad bacteria that patients can have. And that will tell us which of those bacteria they have, how many of those bacteria do they have, and what is the appropriate antibiotics to use in conjunction with the medications that we use in the office and that they use at home to get rid of the infection.
It's an effective treatment plan that goes above and beyond other dental offices. But did you know that this disease is avoidable?
Periodontal disease is very preventable. It's very preventable with great home care, brushing 2 to 3 times a day, and seeing your dentist every 6 months. Very important.
You can also protect your pearly whites with sealants that prevent cavities and gum disease.
With sealants prevent your teeth from future decay. So here on this model, you can kind of see the breakdown of stain getting in the grooves and the cracks of the teeth. So the bacteria will travel there and just harbor and continue to break down the enamel and cause decay. So by doing a sealant, the sealant will seal in the cracks and the grooves of the chewing surface to block those areas so the bacteria and staining and food debris don't get accumulated in that area to cause a cavity. Sealants I would recommend for everyone. It's just the anatomy of our teeth, how teeth form. We all have deep grooves, especially the back molars. Those are the most common areas that patients get cavities.
No matter what you're looking to treat or even prevent, Troy Family Dental has an incredible staff that will take care of you and your teeth.
So at Troy Family Dental, we have a wonderful dental staff that's highly trained to help the patient in everything that they need. We have the most cutting edge technology, whether it's periodontal disease or Yomi robotic assisted implant placement and IV sedation. We just have all of the cutting edge dentistry that patients need and want.
In Troy, Illinois, I'm Chelsea Haynes for Studio STL. You can visit Troy Family Dental in Illinois online by heading to their website at troyfamilydental.com. You can pick up the phone and make your appointment today, 618-623-4094. And again, Troy Family Dental is located in Troy, Illinois. They are 20 minutes from any bridge and have a beautiful facility. So go ahead, give them a call, make your treatment plan today so you don't have to deal with gum disease. Again, it's Troy Family Dental in Illinois.